Good afternoon, everyone. Now, in this session, we are ready for our e-poster presentation program associated with the GERICON 2021 e-conference. And I would be requesting our e-poster team from the Sri Anjaniya College of Paramedical Sciences, Calicut, Kerala, to continue with the program. Thank you.
Good afternoon, everyone. Thank you, Juna Madam. This particular e-poster presentation session is coordinated by me. I'm Stalin, Associate Professor, College of Physiotherapy, SACPMS from Calicut, coordinated with my colleague Jit, Assistant Professor, specialized in neurology. Okay, so first of all, this good afternoon to you all. I welcome the presenters, the participants, and the juries for this session, this scientific session. So I'd like to introduce the juries first. Dr. Pushpendra Advanshi, MPT, specialized in sports rehabilitation. He's Associate Professor and HOD of Physiotherapy, Geriatric University, Kota, Rajasthan. So Dr. Nancy Gandhi, the second jury. He has completed the Masters in Physiotherapy in VNSGU University 2016. So since then, he is working as Associate Professor and the Placement Coordinator in Farul University since 2016. So she has presented 10 national and international publications. Currently, the research is going on in neurorehabilitation as well as the ongoing projects on the spine mat for the patients who is having occupational back pain. Okay, so the third jury, Dr. Vinod Kumar Kesi, MPT, specialized in musculoskeletal and sports rehabilitation. He's quite experienced. He has 14 years of experience, worked in a prestigious institution like Padma Shri College of Physiotherapy, Oxford College of Physiotherapy, and so his field of interest in musculoskeletal and sports rehabilitation. So welcome you all again for this poster presentation. So probably you'd all gone through this policy of this e-poster presentation. This total duration of this session is 6 minutes for the 4 minutes for the presentation. Then you have 2 minutes for the discussion. Okay. So there will be a buzzer. There will be 3 buzzer. One buzzer starts at the beginning of the presentation. Then about 3 minutes we have alarming buzzer. The final buzzer on the end of the session by 4 minutes. So another 2 minutes you have the discussion. Okay. Okay. So hope you all please adhere to this guidelines of this presentation policy. Okay. So now I call upon the presenters by their registration number. Are you all ready? Hope you all ready. These presenters. So the first presenter, the registration number is 2021 00000003.
Yes, sir. Some audible, sir.
Yes, you are audible.
Thank you, ma'am.
With the permission from the judges, can we start, Salim, sir?
Yeah.
Then buzzer to be played, sir.
Yeah, buzzer.
So that she starts.
Jit.
Thank you. A very good afternoon, respected all teachers, all dignitaries present over here, and all presenters. Today I'm here for the GERICON 2021 e-poster presentation with my registration number 2021 times 0 repeated again and 3 with the theme Physiotherapy Care for Older Adults. And my title is Recovery Map for Geriatric in COVID-19, a review. Need of study to create awareness among people for betterment of evidence-based practices. The objective and the goal, the aim of this study is to organize the role of physiotherapy and the impact of COVID-19 on the geriatric population. The methodology where my data sources were relevant articles identified from the online portals named as PubMed, Science Direct, Google Scholar, Cyber, Visco, SourceGanga, and ResearchGate. where the data selection was article related on the recovery map for geriatric in COVID-19, a review. 4 scientific studies were found related to my title, that was the recovery map for geriatric in COVID-19, a review. The introduction, COVID-19 infection has greatly impressed geriatric population. The many literature shows geriatric population majorly respiratory impairment associated with aggravation of the patient's frailty state, including other aspects also like skin problems, fear of falls, and many more. What was the meaning? According to the articles which I found, the definition which is they given, what was the means of recovery, they define what was the rehabilitation state. So it is a state of intervention designed to reduce disability and optimize functioning in individuals with health conditions in interaction with their environment. The result of my review is that more than 20 recent articles are on the geriatric population, in which 4 articles are matched with the recovery map for geriatric in COVID-19, a review. The conclusion of my all over this, which I did the literature reviews, I got that physiotherapy interventions, including breathing exercise and its variant for the respiratory problems, for anxiety and stress relief, like a music therapy, sleep hygiene, and lots of advanced approaches for associated issues like comorbidities. The physiotherapy play indeed a very important role in the geriatric medicines, as the problems are concluded not as much long, but Bowley I should mention the loss of problems for the geriatric population. This literature review concluded that it's called as a second childhood phase, because geriatric population need a care like a child. So this for the because child is the first phase, and in geriatric it's coming into the named as a second childhood, and dementia is the most commonly problem was found over there. So the dementia for the geriatric population is scientifically termed as a senile dementia, as these are some specific terminologies which are used, and we get that recovery protocols, rehabilitation processes, methodology, the way techniques, lots of techniques are available over here, and the literature reviews helps a lot, and a few references are mentioned over my slide. And at last, I would like to show my gratitude to my all teachers for being with me and kind support to me, and especially the team EXRX platform to help me, and to always providing such a beautiful platform to learn a lot, and do this type of knowledgeable information. I get a lot of free information sessions throughout the pandemic, and even continue now. So thank you so much, all teachers. Thank you so much. That's all from my side.
This is a time for the discussion. Over to the judges.
I just want to know what were the keywords you searched for this articles.
Sir, basically I use more than 10 keywords, but specifically I would love to mention here the geriatric and the physiotherapy rehabilitation, and another was like COVID-19 was a geriatric impact. So for these keywords are mainly used. Here I got my relevant data on the online portal. Is it audible, sir?
Okay.
Thank you, sir.
You told that you have 4 articles. What are the outcome measures in all 4 articles?
Any other clarification or any doubts or
Sir is asking, but sir is asking some question, but it is not audible.
Oh, is it?
Yes, a little bit.
Pushpendra sir, you are not audible. Kindly check your audio. You can try without your mic. Take it off from the device and retry.
I'm audible now?
Yes, sir. Yes, sir.
Yes, sir.
Okay, Harshika, one question from my side. What are the outcome measures in those articles you reviewed? Those 4 articles you reviewed, what are the outcome measures in all 4 articles?
So all 4 articles basically concluded about the what was the problems majorly commonly seen in the geriatric populations and how we can overcome by this. Like they are using the general regular physician checkup, and another was like they're using the gait and balance training, and with the help of the general sleep hygiene protocol, they get the overcome lots of good results, or I can say the better recovery.
Okay, so in all 4 articles, those you review, these are all
Yes,
are
sir.
the intervention method. The other are the questionnaire methods.
So basically, they are the use the intervention methods, but they are using commonly 2 scales also. I can
Okay.
mention the for the anxiety purpose, they use a scale named as a CAS, which is a coronavirus anxiety scale.
Okay.
Another was like for the balance and training, they use a tenacity scale.
Thank you.
Thank you, sir. Thank you so much. And it's a great pleasure to have you, sir.
Jit sir, kindly mute your mic, please. Jit sir, please, dear participants and dignitaries, kindly keep your mic mute.
Just one more clarification.
Yes, sir.
Presenter, when you included these articles, did you
Yes,
set any inclusion, the level of evidence to include these articles?
yes, sir. As per my knowledge, I know, sir. So I included the basically the barriers. Like I included that those articles which are not peer reviewed, which are authentically published in a Journal of Physiotherapy, and in the authentic sites like Scopus and Sundanga. I mentioned that my online portals. Another was my inclusion criteria. That was the language, because the publication which is all are in an English language. I includes included in my literature review. Another was like on the working over only the geriatric population. They are my 4 inclusion criteria, sir.
Okay.
Okay. Thank you so much. Thank you so much.
Sir, juries, can I go to the next?
Any questions from Nancy Modi, ma'am?
Yes, ma'am. Please, ma'am.
If no questions from Nancy, ma'am, then we can go for the next one, Stalin, sir, right?
Okay, okay. So can I call the next presenter, juries?
Yes,
sir.
sir.
Yes.
I can.
Okay, okay.
Thank you, sir. Thank you so much.
So I like to call the next presenter 2021000004.
Yes, sir. Am I audible?
Yeah, audible. Go ahead.
Okay, can I share my screen?
Sir, can we have bail for her?
Yes.
So myself, Patel Ria. I am a final year student and I am going to represent Neotech Institute of Physiotherapy from Vadodara, India. Good afternoon to everyone, respected judges. So my topic is physiotherapy care for geriatric community during urinary incontinence. So starting with the introduction, urinary incontinence is defined as an involuntary loss of urine. So there are basically 2 causes, either urologic, for example, bladder cancer or bladder prolapse, and another is non-urologic, for example, any damage to the nerves supplying sphincter muscles causing urethral sphincter incompetence. So according to the prevalence, women are affected greater than the men. The main reason behind this is female urethras are smaller compared to the male urethra, so their supporting system is also less. So if there is any damage to the supporting system to the female urethra, it may lead to the urinary incontinence, and therefore it has a larger impact on quality of life. Coming to the types of urinary incontinence, there are 6 types. Stress urinary incontinence, so it occurs due to any effort or sport activity or during increased intra-abdominal pressure such as sneezing or coughing or like that. And then overactive bladder, it is mainly due to the bladder consuming bladder irritants like caffeine, alcohol, etc. So coming to the overflow urinary incontinence. It occurs due to weakness of the detrusor muscle, that is the bladder muscle, or due to the damage to urethra, leading to the dribbling of the urine. And its classical symptom is nocturia, that means excessive urination during night. Transient urinary incontinence. It mainly occurs due to damage to the muscle sphincters. It occurs actually due to damage to the pudendal nerves, which supplies the sphincters, and also due to some anal surgeries. Then urge urinary incontinence. It occurs due to severe conditions like neurological disorders, for example, dementia. And last one is functional urinary incontinence. It is also known as associated disability urinary incontinence. In this, bladder functions normally, but person is unable to access to the toilet. For example, any physically handicapped person. Coming to the diagnostic scale, that is for pelvic floor muscles, modified Oxford grading system. There are 5 grades. So lower the grade, higher the chances of urinary incontinence. So grades 0 to 3 represents inactive or underactive bladder, and grade 4 and 5 represents normal bladder. Coming to the physiotherapy management, there are 3 techniques. So pelvic floor muscle training. It is necessary to ensure proper contraction of the levator and eye muscles. They are made up of 2 types of fibers, type 1 and type 2, slow and fast twitch fibers respectively. So it is also necessary to train the type 1 and 2 fibers also. And patients are typically recommended to perform exercises 4 to 5 times daily. Also, combination of PFMT and transverse abdomen is also proven effective. Coming to the behavioral therapy, here we focus on lifestyle changes. So for fluid and diet management, we ask the patient to reduce fluid intake and increase fluid in the diet. So in order to avoid constipation or dehydration, weight control is necessary because obesity is a risk factor. And also we educate the patient to avoid straining if there is an issue of constipation. Bladder training. It is necessary to increase bladder capacity. So our suppression techniques are used, such as distraction by focusing on other muscle groups and relaxation by deep breathing. Also, it is important to teach patient for voluntary contraction of pelvic floor muscles, so that it will cause inhibition of the detrusor muscle in order to prevent leakage. Kegels exercises. Bridging is the most effective and reliable exercise in geriatrics to strengthen the pelvic floor muscles. Thank you.
Yeah, it's a time for the discussion to the judges. Any queries?
Audible, Ria?
Yes, sir.
Okay, those paper you present here, it is a article review or it is a any type of research from you have any type of project work you have done?
Yes, sir. It is a type of project work.
It is a type of project. Okay.
Sir, kindly little bit louder, sir. Pushpendra sir.
Yes, yes. Now audible, clear?
Yes, sir. Very much.
Okay, okay. Okay, Ria. Thank you.
Thank you, sir.
Next judge, please.
Any jury members?
Ria, could you conclude what is your take-home message from your whatever small-scale study what you have done? What is the take-home message in this topic from you?
Sir, actually what I want to spread the message is urinary incontinence is very common nowadays in geriatric community. So therefore there is less awareness about urinary incontinence. People prefer pads and then medical interventions. So for adult diapers and like that. So it is necessary to make awareness regarding physiotherapy. That physiotherapy is also very helpful, like such as Kegels exercises. It has proven many most effective treatment. That's why.
Okay. Okay. Thank you.
Thank you, sir.
Ria, what is your registration number?
Sorry?
Registration number? They mention a 3 registration number. 433. So which one
Actually,
is
that is a second author and third author are also
You are the
present.
first author, it's okay.
Okay, done. Thank you.
Thank you,
Okay,
sir.
okay. And I request those who are presenting put your registration number, not your names. The presenter should put the registration number as screen name, not your name. It's okay, Ria. It's okay for the next presenters.
It's done already.
It's done.
Okay, no problem.
Nancy,
Jit sir
madam,
and
are you there?
Stalin
Any
sir,
question?
please kindly inform to the participants, please.
Okay, sorry, sir, for the inconvenience.
Yeah, no issues, madam.
No issues. It's okay.
No problem.
Nancy, madam, are you there? Any questions?
No, sir. No questions. Thank you.
Okay. Yeah.
Thank you, ma'am.
Welcome.
So if everything is okay, can we go to the next presenter?
Yes.
Okay. Okay. Can I check with Milind Kaki, the registration number 2021000041? Are you there? Milind Kaki? Because she wanted to prepone the session, so that is why.
Sir, we will inform him, sir. We just proceed with the next participant.
Okay.
And communicate.
Yeah. So I'll call upon the next presenter, 2021000006.
Hello. Can I start, sir?
Yes. Yes, you can go ahead.
Hello.
I can go ahead.
Yeah, certainly.
Good afternoon, everyone. Hello. Am I audible?
Yes, audible. You can go ahead.
Yes. Good afternoon, everyone. I'm presenting the literature review on the effect of resistant exercise on the elderly populations with the mild cognitive impairment. Background about the disturbing mental actions or the processing the acquired knowledge, understanding well advice, experience, and the sense. And the mainly it's due to the aging. I'm talking about the aging. In the aging, with increasing the aging, they are decreasing the size of the brain, and there is the decrease in the white matter and the gray matter, where they are affected mostly. In the gray matter, there is the decrease in the prefrontal cortex and the temporal lobe, which is also a hippocampus, which is work as a memory. And in there, loss of the neurons it occurs. In the white matters, there is decrease in the frontal lobe, and due to this, there is the decrease in the number and the length of the dendrites, which loss of the dendrical spines, and it cause the decrease in the number of the axons, which cause the segmental demyelinations, and this cause the loss of the synapses, which due to the loss of the synapses, there is a cognitive impairment. And resistance after the aging, there is the cognitive impairment. Resistance exercise, which help in the increase in the cerebral blood flow, which also help in the due to the increase in cerebral blood flow, helps in the increasing the brain derived neurotrophic factors, and it enhance the synaptical plasticity and the hippocampus neurogenesis. It's helps in the increase improvement in the cognitive functions of the aging populations. And purpose of this study is the benefits of the resistance exercise on the elderly populations with the mild cognitive impairment. And in the methodology, search engine through the Google Scholars and the PubMed, and inclusion criteria, peer review, elderly peoples on the basis of the level of the evidence, IA and IB with the cognitive impairment, and exclusion criteria, irrelevant articles, and a timeline from 2020 to 2021. And the 8 articles were selected based on the inclusion criteria. Keywords are using while searching: aging, cognitive impairment, resisted exercise, and the dementia. And discussion and the conclusions from the level IA of the evidence from the meta-analysis review shows that the acute and the chronic physical exercises helps in the improving the cognitive impairment by increasing peripheral brain-derived neurotrophic factors, and the improvement in the cortical activity increase functional brain network connectivity by the physical exercise helps in the improving the cognitive functions of the aging brain. And another level IP of the evidence from the randomized controlled dual task multimodal physical exercise at the moderate intensity improves cognitive functional mobility and
Excuse me.
cardiorespiratory. Yes, sir.
This time is over, right? Jit, sir? The time is over. Just hurry up in a few seconds time.
Okay, sir. Level 1B of the evidence from the randomized control trial shows dual task multimodal physical exercise at the moderate intensity improves the cognition functions, mobility, cardiorespiratory conditioning, and the quality of the life. And these are the results. I've taken the 2 randomized control trial out of 8 reference, and 3 are the meta-analysis, and 3 are the systemic review. These are the differences. Yes, sir. Thank you, sir.
One question from my side.
Hello. I'm not audible, sir.
Hello.
Judges.
Audible now?
Yes, sir.
Yeah,
yes, sir.
Okay,
Now
okay.
audible, sir.
One question from my side. What is multimodal exercises? What will you include in a multimodal? Can you explain?
In dual task multimodal, this is the physical exercises here. We are giving there is the one two groups are there. One is the control group, and the one is the exercise group. There we are giving the physical exercise, and
multimodal means there are the various type of exercise they include in a multimodal. So what type of exercise in your review in that your articles? Can you explain?
In here multimodal, there is giving the cardio with the resistance exercise. There is the cardiorespiratory exercises also included.
Yeah, so these type of multimodal exercise you go through both the group A and B. Yeah, you differentiate between.
No. Only for the exercise group only.
Okay.
Another group is the.
What is the conventional group? What about conventional group? You not read your fully the article. You prepare a paper only. Okay, you make a poster. Okay, nothing to be worried. Thank you, my dear. Another jury members, welcome.
From your literature review or knowledge, can you just correlate exercise with the cognition impairment?
Sir, here the resistance exercise which given in the articles mostly there is the with the theraband and the dumbbells and like the 3 sets.
No. I'm not asking what all the mode of exercise. I'm just asking you, can you correlate the relation between exercise and cognition? That's all.
Sir, resistance exercise, while doing this in our body, there increase in the blood circulations. It suppress the blood pressures in the body. So due to this, in the brain, there also in the brain also blood circulation is increased. So there is the cognitive due to this blood circulation and brain derived neurotropic factors will increase in the brain, which enhance the that synaptic plasticity and the hippocampus neurogenesis, which also work in the synaptogenesis and neurogenesis and angiogenesis and gliogenesis.
Okay.
So
Okay.
this
Thank you.
helps in-
Thank you. Thank you.
Yes.
So can we go to the next presenter, sir? Dr. Pushpendra Advanshi, can we call upon the next presenter?
Yes, yes, sir.
Okay, okay.
From my side.
Okay. The next presenter, 2021 0000007. Are you available? 2021
Hello.
00. Yes. Yeah, you can go ahead. Your time, sir.
I can go. Okay, sir. I'm good afternoon, everyone. I'm presenting a poster on effect of 5-fit exercise on balance in older adults, a literature review. Introduction. Here, like poor balance is the leading cause of falls, greatly affecting the personal independence and quality of life in older adults. And common age group affected is 65 years and above. Static and dynamic stability, sensory integration, and reactive postural controls. These components can be improved by interventions, making balance a modifiable risk factor. The Mindato Wii Fit ExRxIndia provides aerobics, strength, and balance training using a balance board. And the objective of this review is to review the effect of Wii Fit exercise on balance in older adults, methodology, search engine PubMed and Google Scholar. Keywords here are Wii Fit exercise, balance, falls, and older adults. Inclusion criteria, peer-reviewed articles, and on the basis of level of evidence 1A and 1B, timeline 2017 to 2021. Here, 6 articles were included based on the inclusion criteria. And in the articles which are included were 2 systematic review and meta-analysis and 4 randomized control trial. In the randomized control trial, in this tool, there were 2 studies which showed improvement with a balance with a Wii Fit exercise intervention, which was for 8 weeks. And here and for 8 weeks, and systemic review also showed, which included of RCT studies, it showed a very good improvement with this intervention. Discussion and conclusion. Wii Fit is designed to improve posture control in static and dynamic position. Wii Fit is a balance board exercise system that has been tested and as an exercise intervention using various study designs with a mixed results. Wii Fit is a safe and feasible for the older adults. Wii Fit exercise program have the potential to improve the balance and reduce the risk of falls in older adults. Thank you, sir.
It's a good time management over to the judges.
Could you also highlight upon what all the other kind of exercises are there for increasing balance in older adults?
Like Otago exercise programs, that is for balance, and other balance exercise like tandem walking, heel, tiptoe walking, and
Actually, my point was because
Yes,
you are emphasizing on these exercises. So how superior these exercises from other exercise protocol? Can you make a comparison?
Yes, one study which I have included in this, they are saying like both Wii Fit and balance exercise have the same improvement. Like they have same significant. It is both can be used to improve the balance.
But what you debate upon, which one is better?
I debate like Wii Fit has more like Wii Fit can improve balance. Wii Fit.
No, both can improve. Why this? Why you think this is superior to other? Okay, thank you. Thank you.
Okay. Okay.
No question from my side.
Any other questions from jury side?
No, sir. No, Stalin, sir. No question from my side.
Okay. So can we call the next presenter?
Sure.
Okay.
Nancy, madam.
Nancy, madam. Mohan Kumar sir. Vinod Kumar sir.
No, Vinod Kumar sir asked actually.
Yeah.
Yes,
Oh,
sir,
okay,
I'm
okay.
Sir,
Yes, madam.
I am here. Bolo.
Okay, okay.
Yeah. No questions from you?
Yeah.
No questions.
So, I will call the next presenter. Registration number 2021-00-0008. Are you there? 2021-00-00-008.
Hello.
Yes. Yeah.
Hello. Am I audible?
Yeah. Audible. You can go ahead.
Good morning, one and all present here, dignitaries and juries. My registration number is 08 and I'm going to present the literature review today. So the topic of this is the effectiveness of perturbation-based balance training to reduce risk of falls among elderly people. It is a literature review. So perturbation balance training is a form of training that aims to improve the reactive balance control after unexpected external perturbation. It is an intervention involving repeated postural perturbation aiming to improve control of rapid balance reactions. It is potentially lead to the fewer falls and improved clinical outcomes. Balance boards are generally incorporated in perturbation-based balance training. Besides improving balance and reducing risk of falls, perturbation-based balance training can significantly reduce the fear of fall also. Fear of fall can have a major impact on the older adults. And the clinical application of this would be adaptation many occurs faster in perturbation balance training and often potential to achieving equal and better results with the fewer training sessions. So usually double leg foam balance activity, tilt board balance training, and roller board and platform perturbation would be used. And so in this poster, I have taken six articles. And the objective of this review is to review the effect of perturbation-based balance training and reducing the risk of among elderly people. So the search engine which I have used is the PubMed, Google Scholar, Pedro, and the Scopus. Keywords which I have used is a perturbation balance and risk of falls and elderly population. Inclusion criteria for my study is the peer-reviewed articles, English articles, and strictly on the basis of level of evidence, that is level 1A and level 1B, which includes only systematic reviews, meta-analysis of the RCTs, and randomized control trials only. And the timeline which I have referred is 2017 to 2021 only. Based on the inclusion criteria, I have taken 6 articles which fulfilled the criteria. Concluding all these things, my conclusion was perturbation-based balance training can improve balance recovery performance, leg strength, reduces risk of falls, improve different strategies to avoid falls, reduces fear of falls. Also, it can be used particularly when intervention time is limited, when faster recovery is expected. Therefore, this training intervention uses paradigm, which may be an effective strategy for fall reduction or reducing risk of falls in elderly population. Here in this study is in this literature review, I have taken the studies randomized control trial, which you can see in the results. There are 5 randomized control trial. Among all these 5 randomized control trial, all of the studies have divided the groups into two groups. One is the control group and one is the experimental group. On an average, if I tell you, they have taken inclusion criteria age above 65 years old, and exclusion criteria they have mentioned is the one who is already under physical activity, they have excluded them, and the one who had fracture in past 10 years, one who had gone under any limb fractures and they have gone under lower extremity surgeries, and the one who had ankle hip arthroplasties and within past 12 months, and osteoporosis of lumbar spine, and one who had any other unstable medical conditions. They have excluded all these conditions and taken the participants in the study. On an average, all the sessions were from 4 to 6 weeks, and each duration of each session was average 45 minutes. One study have taken duration like half an hour to 1 hour, and 2 to 3 studies have taken duration of each session 45 minutes. And yes, sir.
Yes, yes.
Yes, sir.
Yeah. You just hurry up. Your time has finished. You try to finish it in few seconds. Huh?
Okay, sir.
Okay.
Yes, sir.
Could you tell us out of this 5 or 6 articles,
yes,
what were the common the objective outcome measures that they have used in your articles?
So commonly they have used this push and release test, and one study have taken their one leg strength test, and yeah, commonly push and release test they have done.
Because they are checking the balance. So I
Yes,
just
sir.
wanted to know what all the objective methods they have used for check the balance.
Yes, sir.
So only one test, what do you want to say? The push?
Yes, sir. Commonly that have been implicated in most of the studies, and one study have included their plantar flexion movements, knee movements that have been assessed, and yeah, that only.
Okay.
One question from my side.
Yes, sir.
One question from my side. I'm audible,
Yes, sir.
clear, audible?
Yes, sir.
What
A little breakage is there, sir.
Okay,
Sorry.
okay. Now it's clear?
Yes, sir. It's clear now.
Okay. You include what type of inclusion criteria, what type of geriatric populations you included in these 6 review article? There are any balance impairment, or they are the normal geriatrics?
No, sir. 5 of the studies have included all the healthy adults only.
Okay, healthy
Yeah.
adults or
5
healthy?
studies included all the healthy adults.
Okay. And
Healthy,
there is
healthy
no.
older adults. Sorry. Yes, healthy
So
older adults.
what are the mean age?
No, sir. No other condition.
Okay.
Mean age
Thank
is
you.
65 years to 85 years.
Okay.
Yes.
Okay. So there is any impairments in the balance, or there are any impairments in the balance in those peoples? Any type of
No,
balance
sir.
impairments?
As per my knowledge, no, sir. No balance impairments.
Okay. Thank you.
Yes.
Over to Sterling, sir.
Any other?
Yes. The discussion is over, right?
Yes.
Yeah.
Any questions from?
If Nancy ma'am asks.
So can I call upon the next presenter?
Sir.
Thank
So the next
Uh,
presenter,
excuse me, there is
if
a
no more
question.
questions, I can go to the next presenter.
Sir, excuse me.
Have a
There is
question,
a
madam?
question. Because
Yeah, yeah,
question related
yeah,
to,
yeah, yeah.
see, in objective, it is mentioned that effect of, perturbation based balance training. So here you are focusing on perturbation or you are focusing on balance training?
Perturbation-based balance training. So,
So
ma'am,
there
I
we,
already mentioned that they are divided into two groups, control group and experimental group. So, in
Mhm.
experimental group, they have given the particular perturbation-based balance training only. In control group, they have implemented conventional balance training,
Okay.
like
And
Otago exercises
and
or
and
any other
see
balance.
see when there is a correlation with perturbation, so it is basically a dynamic balance training that you are going to provide, right?
Yes, sir. Yes, ma'am.
Okay,
Yes.
fine.
So the main conclusion was that it increased the dynamic stability, dynamic gait stability, and reactive balance control.
Okay, fine. Continue. Thank you.
Thank you.
Yes. Okay, right. Can I? Hello. Can I call upon the next presenter if no queries, no more queries regarding this topic?
Yes, sir, you can.
Okay. So the next presenter 202100000009. Yes. Bell. You can go ahead.
Full screen, please.
So the screen have not yet opened. Good afternoon, everybody. My topic is home, the new workout space for elderly. This refers to the medical care for older adults, an age group that is not easy to define precisely. COVID-19 older people's daily roles, the care and support, their ability to stay socially connected and how they are perceived. It is therefore important that we create to foster healthy aging that the pandemics. Here, COVID-19 pandemic lockdown is discussed and some recommendations on the physical exercises for the older adults to maintain their level of independence, physical health, as well as their well-being are provided. As we are aware of the fact that as aging increases, the physical activity is reduced and thereby physical inactivity enhances, which initiates sedentary behavior. Sedentary behavior, as we know, is being defined as any energy expenditure that is less than 1.5 metabolic equivalents. Our poster presentation is focused on workout space being arranged at home, which has much relevance during this pandemic era. Now discussing about the home-based exercises that could be applied to the geriatric population includes aerobic exercises. Aerobic exercise includes walking, which is considered to be the one of the best form of exercises that could be initiated within the home atmosphere. Interval training is one of the best and the cost-effective method of treatment management in geriatric populations. Protocols like Tabata protocols have gained much relevance during this pandemic era. Resistance exercises. Resistance exercises, the thing to be noted in geriatric population is that the material that we use for the training should never be a barrier. Some accumulative exercises. Accumulative exercises include walking with either in 2 sessions or as a single sessions. Respiratory exercises. Respiratory exercises have to be largely focused because despite whether the patient is affected with COVID or not, geriatric populations' respiratory functions and abilities would be largely reduced. Respiratory muscle training, including deep respiratory breathing exercises, diaphragmatic exercises could be initiated. Flexibility and balance issues are the two kind of issues that the geriatric populations faces largely. Flexibility exercise and balance exercises could be initiated into the daily training program with strict monitoring so that there is no fall or other injuries associated. ExerGames. ExerGame is an easy-to-use tool for decreasing the social isolation and reducing anxiety disorders, which includes not only just the patient but entire family. Last but not the least, the technology and online exercises. This is one of the form of exercises or the technology that have gained much relevance during this era of pandemic and have opened a new and better door to the rehabilitation science. Various kind of online programs in the form of rehabilitation runs worldwide, and for taking an example, one of the successful wonderful program that runs today in the state of Kerala, that is ventured by the government of Kerala in association with an organization called KTC, is called as Yukti. How home program works, or how the exercise works at home. As any other exercise regimen, the effects would be same, but why the exercise is being done at home is a relevant topic. It is during this pandemic era that the physical activity of the individual is reduced, which not only affect the geriatric population's physical health, but also to the mental health. To that state, it is very important to ensure the exercises. During this era of pandemic, there arises an increasing demand among the community for exercises. The exercise should be prescribed, should be highly individualized with respect to the need of the individual. It is not just the pandemics, but also outside such critical periods, home is the new workspace. Making patient independent at any age is considered to be the credibility of the therapist, and always prevention is considered to be a better than cure. With this note, thank you.
Thank you for your presentation. Over to the judges, the time for the discussion.
As you have mentioned very rightly that exercise is the most important thing, and also you have emphasizes on how the pandemic has changed the perception of exercises. Only one concern about from my point is you have told about these exercises, keeping in mind the comorbidity the kind of population, elderly population has. How safe are these exercises at home?
So according to WHO organization, this year they have initiated a calculation that due to physical inactivity, it have led to the 4th major cause of death worldwide. So it is very important that we should ensure that geriatric population should be given physical activity. They should never become physically inactive. That not only affects a single population, but including the GDP, the growth of the nation is being affected. So it is very important that we does exercises, or we initiate exercises like highly individualized, and it is not like a particular group we could give everything. No, it is like we assess the individual to online modes itself, and each individual would be addressed with a need what they are supposed to.
Yeah, fine.
Okay. I'm having one question. Do you have specific population that you are going to include over here? As you have mentioned, elderly people. So there are specific population that you are going to include over here. So do you have that? I mean, that particular age group?
No, ma'am, it is about generalized geriatric population. As we all know, we cannot, as in every country, how geriatric population is being considered, the age group varies. It depends upon what the patient needs, his requirements, how his physical ability, and how much he is having the sedentary behavior that we plan.
All right. Thank you.
Thank you, ma'am.
No question from my side. No question from my side. Continue, Stalin, sir.
Thank you, sir.
Okay. Stalin, sir, continue to call from next participants.
Thank you for your presentation. If you know no questions from the jury side, can I move to the next presentation? Next presenter.
Yes, sir. Continue, sir. Next call for next.
2021 00011.
Yes, sir. Is my voice audible, sir?
Yeah, it's audible.
Can I start, sir?
Yes, you can go ahead.
Good afternoon, one and all. I'm here to present a poster on the topic clinical assessment of sarcopenia in hip fracture patients among the elderly. So what is sarcopenia? Sarcopenia is defined as a syndrome characterized by progressive generalized loss of skeletal muscle mass and strength with risk of outcomes such as physical disability, poor quality of life, and mortality. So aging is inversely proportional to muscle strength and muscle mass. And according to the revised European Working Group for sarcopenia and older persons, they defined sarcopenia as an acute or chronic disease based on levels of 3 measured parameters. What are the 3 measured parameters I've given below? First one is muscle strength. That is the primary indicator for sarcopenia, according to the revised definition. Next, for diagnosis, we'll have to measure the quality and quantity of the muscle using various tests. And finally, to grade sarcopenia as severe, we have 3 tests, like if the muscle strength is low, and if the muscle mass is less, and if there is poor physical performance, they say it's severe sarcopenia. And sarcopenia related falls and fractures play an important role in our society due to increase in the average age of the population. So sarcopenia results in hip fractures, maybe one of the comorbidity associated with hip fractures, and sarcopenia results in enhanced mortality, reduced activities of daily living, impaired activities, then the quality of life is affected, and the morbidity is also perpetual morbidity, and also there is increase in the economic impact on the society. So moving on to diagnosis, how do we assess sarcopenia? According to EWG SOP2, the revised guidelines, we have a set of tests which are actually recommended by them. The tests are given in the middle, that is appendicular skeletal mass, then appendicular skeletal mass by height, then hand grip strength, chair stand test, and few performance tests like gait speed test, SPPB, TUG, timed up and go test, walk test. All these tests are recommended by the new revised guidelines according to EWG SOP. But when we talk about patients with hip fractures, all these tests, most of these tests are not possible. And to evaluate muscle strength, only 2 tests have been selected, like hand grip strength and the chair stand test. These are the 2 tests recommended for muscle strength. Among this, hand grip strength is a proxy. It is used as a proxy to evaluate the muscle strength of the whole body. Chair stand test is used also a proxy for evaluating the lower extremity strength, that is quadriceps. But however, this test is not possible in patients with hip fracture. Alternative methods are hand grip strength and the knee extension strength. See, hand grip strength, why hand grip strength? Hand grip strength is a very feasible method which can be performed at the patient's bedside using a handheld, a dynamometer with a trained therapist nearby. And of late, recent studies, according to Alonso et al. In 2018, they have found out only a fair relationship between hand grip strength and the overall physical performance of a patient. So, of late, recent studies have included knee extension strength, which is a measure of the quadriceps, or that is the knee extension strength of the contralateral limb of the fracture. See, if the right limb is fractured, we are using the left leg for assessing the strength of the knee extension. Conclusion, knee extension measure is found to be feasible to assess the physical performance in post-acute fracture or post-operative patients. And why that is because knee extension measure it's most associated with physical performance activities like gait and other tests which are mentioned in the guidelines. And of late, there are biomarkers also under study which can actually help us to diagnose and evaluate the prognosis of sarcopenia in patients with hip fractures. Thank you, sir.
Yes, over to the judges. Time for the discussion.
Can you just highlight upon the grades of sarcopenia?
The grades of sarcopenia or the diagnosis, sir?
No, grades.
First, we have probable sarcopenia status. And for that, muscle strength is the primary indicator. If there is if they identify the patient to be having probable sarcopenia, next, based on diagnostic tests which are used for muscle quantity and quality, they will actually send the patient to the next level. And if to be graded as severe sarcopenia, we'll have to measure all the three parameters, and all the three parameters have to be at lower levels, like low muscle strength, low muscle mass, or the muscle quantity or quality is less, and the physical performance will be poor. If in such cases, the patients will come under severe sarcopenia.
So these tests are...
What is performance test?
So your voice is not audible.
Find me that performance test, as you have mentioned in your chart paper, that performance test with assessment of the what is that, and what is the role behind sarcopenia of performance test?
Performance test like gait speed test, timed up and go test, 400-meter walk test, all these tests indicate the severity to grade the patient as severe. All the performance tests will be poor in such patients. So when patients with low mass, low strength, and low performance, the patient will be graded as severe sarcopenia.
Can you just tell me about sensitivity of these tests?
Yes, sir. So according to a study proposed, in a study proposed by Morton Tankerson, this test was found to be reliable. Actually, I'll give you the exact study names. Reliability of handheld dynamometry testing and assessment of knee extensor strength after hip fractures. According to a person called Roy in the American Journal of Physical Medicine Rehab in the year 2004, they said this test is reliable and can be used in special situations like fractures.
Not sensitivity. Reliability is different and sensitivity is different.
Yes, sir. Yes, sir. So maybe I will exactly refer this journal.
Thank you. Thank you. Thank you.
Thank you, sir.
One question from my side. Hello.
Yes, sir.
One question. How to score the chair strength test greater than 50s for 5 rises?
How to grade a chair strength test?
Means when you person is assessed to the chair strength test.
Yes, sir.
So what is the meaning of chair strength test greater than 50s for 5 rises? So
So
how to score?
seconds.
How to score that particular person are 15s for 5 rises? Can you explain the term?
So the patient has to rise from a chair without upper limb support 5 times. If the time taken for these 5 races is greater than 15 seconds.
15 seconds.
Okay. Seconds, yes, sir. The patient will be coming under poor physical performance.
Okay. So the chair strength test, this is for 15 seconds. Is there any evidence base, or you can make?
Yes, sir. According to the revised guidelines given by EWG SOP 2 guidelines in 2018, this is the cut points given by the European working group, sir.
Okay. Okay. Thank you.
Thank you, sir.
Over to Stalin, sir, for calling the next participant.
Thank you for your nice presentation. So over to the next presenter, 2021000041. Are you there? 41 registration number 2021000041. Milan Kaki.
Is it Milind Kahile, sir?
Yes, Milind.
Yeah, he is there by his name in the Zoom actually. Milind, sir, you there? Hello? Any more other left, sir?
Okay, I can presenter. I think he is not available.
We can go for the next one, sir, and again we will be requesting later.
Okay, so the next presenter will be 202100000014. Registration number 14.
Yes, sir.
Presenter, please join the cam.
Akhil, are you there?
So
Yes,
registration number 14, right?
Yes, sir. Yes, ma'am.
14.
Okay. Kindly join video, Akhil.
Yes, ma'am. Very warm good afternoon to one and all present here. Respected dignitaries on the judging panel, my fellow delegates and my dear friends. But coming to the topic of my poster is the efficacy of three-dimensional exercise in the background of my study. Scoliosis is the lateral curvature of the spine in the upright position. In the clinical settings, the corpse angle analysis method is generally used. Minor scoliosis with less than a 20-degree angle requires a periodic observation, and scoliosis with a corpse angle 20 to 40 degree requires a wearing of an orthosis to prevent progression. Scoliosis causes deformation of the spinal column and associated structures, decrease in the spinal flexibility by changing the characteristics of the erector spinae muscles, leads to the imbalance of the trunk and pelvis. Growth method involves pelvic action, length of the spine, performing active breathing and testing the trunk muscles to maintain corrected posture. Objective of my study is to determine the effectiveness of Scroth three-dimensional exercise to improve corpse angle, vital capacity, and reduce pain of a female geriatric patient of age 69 with a right side idiopathic thoracic scoliosis. Methodology: subject performed the Scroth exercise 3 times a week for 12 weeks. At the time of the exercise program, both pre and post measures of the pain, corpse angle, and vital capacity were taken. Materials required for Scroth exercise program are the doorway chin-up bar, gate belt, wooden poles, TheraBand, soft gym ball, SPRA band, foam rolls with the holes and TheraBands, exercise ball. Scroth three-dimensional exercise is based on sensory motor and kinesthetic principle. Outcome measures used were visual analog scale, corpse angle, and spirometer. Case description: a 69-year-old woman was diagnosed with a right side idiopathic thoracic scoliosis whose corpse angle was 28 degree. Chief complaints were difficulty in breathing that interfered the sleeping pattern and pain. Result: the patient in our study has corpse angle decreased, vital capacity increased, pain on visual analog scale has reduced. And by attaching the X-ray for review, conclusion and clinical implication. The 12 weeks Scroth exercise caused a significant effect on corpse angle and vital capacity. Hereby I conclude that if the Scroth exercise is much effective for treatment of scoliosis rather than any other traditional methods. Thank you.
Okay.
Thank you, sir.
Yeah, he has done the presentation. Over to the judges.
Have you compared this with any other technique to say this is better?
No, sir, didn't compare.
No, but you made a statement that this is better than any other method of exercises.
So it is because usually in our traditional methods and all, we used to stretch the shortened side and we used to strengthen the lengthened side. But in this particular method, it is not only combined of a single method. It consists of lots of method integrated. So like that, by giving a proprioceptive feedback, giving principle, motor and feedback. So I hope it will be much effective than other techniques, sir. That's why.
No, that has to be proven. That has to be study must be proven, right?
Yes, yes.
So
Yes,
we
sir,
should
yes.
we should not make a generalized statement like that.
Okay, okay, sir. Thank you.
Excuse me.
Excuse
Thank you.
me,
Okay.
sir. Excuse me, sir.
Okay, sir.
Yes.
Can you define this three-dimensional exercise therapy? What you're going to do in this particular, because as your condition is idiopathic thoracic scoliosis, na?
Yes, ma'am.
So
The methodology, the criteria for the exercise which I had given is combined of 3D, which is the deflection, derotation, and the muscle cylinder technique. The deflection and derotation techniques, which include by redirecting the patient's spinal alignments. That is by training in front of a mirror, and we used to kept a scroll bar in front, and we used to tell the patient to align your pelvis and apply a downward pressure. At the same time, the therapist will stand on the backside of the patient, and he will give a proprioceptive impulse or proprioceptive or tactile stimuli on the patient's rib cage or the patient's vertebrae, which have to be straightened. So at that time, we are giving a proprioceptive as well as a tactile stimuli. But by redirecting the patient's breathing towards the concave side, what happens is that the concave side actually stretches. That is the muscle cylinder technique, ma'am. 3D muscle cylinder technique.
as you have mentioned that idiopathic thoracic scoliosis, so I mean,
yes,
you are going to improve with assessment or only by evaluation? There are some specific features that we need to point out, and based on that we can go for our exercise therapy protocol, right? So that is why I'm asking you, sir, because it is bit terrific, I guess.
Yes, ma'am. Because the main criteria we had aimed is that to improve the patient's corpse angle, to reduce his pain, and increase the vital capacity, ma'am. But at the end of the study, we proved that, ma'am, because the corpse angle, as we can see in the X-ray, ma'am, first it was 28 degree, ma'am. Then it had reduced to 24 degree. Afterwards, it had reduced to 21. Then to 18 degree, ma'am. Within the 12 weeks of this treatment program, there showed a significant decrease in the corpse angle, ma'am. That's why. And also in the pre and post test of the VAS scale, the pain has reduced, ma'am.
Okay. Thank you.
Thank you,
ma'am. One question.
Yes, sir.
From my side.
Yes, sir.
The SCORT program is already mentioned the 12-week session. So you have how many sessions in a week? 1 or 2?
No, sir. Three sessions per week, sir. For 12 weeks.
But the length of the SCORT program maybe typically consists of 1 or 2 weeks, 1 or 2 sessions per week.
No, sir. 3 sessions per week, sir.
3 sessions.
Yes, sir.
And what are the role of the physiotherapist? Physiotherapist assess the patient, or physiotherapist is the main role of the doing the protocols?
Main role in doing the protocols, sir.
Main role means all the exercises are guided by the physiotherapist.
Yes, sir. Yes, sir. Yes.
Okay, so you assist the patient, or you each and every time you in front of the patient you actively participate to the patients?
Yes, sir, I had actively participated, but the thing is that at the first time only I need to demonstrate afterwards the patient had actively learned it, patient itself had done, sir.
In complete 12 weeks study, you observed this patient in all 3 sessions?
Yes, sir, all 3 sessions. I has been together with the patient only, sir.
Thank you.
Any follow-up you did?
Yes, sir, follow-up we did, sir, but afterwards the COVID outbreak had done, we had started the tele-rehabilitation, sir. That time also, at the time of the treatment regimen also, we had trained a bystander of the patient, this exercise. So they are following it at the home, sir.
Okay.
Thank you, sir.
Any other questions from the jury side?
No, sir.
Okay. Thanks for your presentation.
Thank you very much, sir.
Thank you. So over to the next presenter. The next presenter, registration number 2021000012. Are you there?
Yes, sir.
2021000012.
Sir, am I audible?
Yes, yes.
Okay. Good afternoon, everyone. I am here to present the poster in the GERICON 2021 on the topic PT in older adults for COVID patients, and my registration number is 2021 000012. As we can see in the first image, it is showing as the aging occurs, immunosenescence occurs, the pro-inflammatory and anti-inflammatory cytokines increases, and there are more chances of the pulmonary infections. So before COVID, the older adults used to perform activities, go outside, but as the COVID occurred, there was the increase in the falling, loneliness, and their life quality was decreased, their physical activities were decreased. As introduction, aging is associated with the reduction in physical function and increased sedentary behavior, and according to WHO, it has announced coronavirus outbreak that poses a considerable challenge to human health, especially the older peoples, as they are more prone to infection. And as it is showing the diseases through which they are more prone to the cerebrovascular diseases, it includes 10.5%, diabetes in 7.3%, chronic respiratory disease 6.3%, hypertension 6%, cancer 5.6%, and other conditions. And as the COVID has occurred, there were continuing services were provided. That was regular OPD and IPD services. There were older adults were also informed about the pre-COVID preparedness, like how to maintain, this was specially done through the telehealth, that was how to maintain their diet, how to increase the physical activities. That is the main motto, is they should be moving, there should be no restricted their range of motion, and how they can alter in the weight. And during lockdown period, care was taken for the ambulatory patients at home, that is there through digital learning, they were taught that they should be moved continuously, they should not sit basically, so there can be more chances of infection, and how during lockdown they were treated. Then the most target is on the PT management that is done. That includes respiratory exercises, that is the diaphragmatic breathing exercises, pursed lip breathing, and the most positioning was the prone positioning and chest expansion exercises to remove the cough. Then the target was to improve the balance and coordination, that includes obstacle walking, that is the different obstacles were set and they have to cross it. Lateral walking, that is a sideways walk, and reverse walking, that is a backward walk, that improves the strength and prevent them from falling. And exercises to improve endurance, that is a cycle ergometer, as many patients were when they were in the ICU or in the bed, they were unable to move their body the infection occurred. So this is the best instrument through which we can continue the range of motion. Movement should not be restricted. Or stair climbing, those who are at home, and generalized or low impact aerobic exercises like walking or walking, they should walk in their home only. Or then exercises to improve muscle strength, that was resistance training and multi-joint exercises. And I have also studied review literature. I have also studied in the article that patients were applying neuromuscular stimulation as a mobilization, that is according to Mulligan, that is a skill passive technique to increase the range of motion and to decrease the pain. Chest physiotherapy, that is includes the breathing exercises and the percussion and vibration techniques, and bed cycle ergometry, as I told before, and active exercises, that once the sedation has stopped, so all the medicines have stopped, they can perform the movement their own, and strengthening exercises and walking after the discharge. So the conclusion is it is essential to ensure older patients should stay safe at home and care. Of course, all of us should stay safe at home. And in this corona pandemic, the telemedicine has helped a lot through the physical consultation, especially the physiotherapist has also important task during the ICU and also after the discharge. Thank you.
Yeah, over to the judges, sir.
No questions from my side, sir.
Okay, sir. So any other questions from other
one
juries?
question from my side.
Yes, sir. Go ahead.
This is not a review article. This is this is your project like informations.
So actually, I have reviewed the article, 3 articles, and from that I have concluded these.
So there is no written statement in your headings. It is a review articles.
Yes, sir.
Okay. So what will we review?
Yes, sir, I have reviewed that during the lockdown also services wasn't stopped. Telemedicine has helped a lot. And what are the all exercises after during the COVID patients should be provided, like respiratory exercise or breathing exercises, percussion, vibration, and bed cycle ergometry. That their motion should not be restricted. That is basically our task was the physiotherapist's task was not to stop their motion. They should walk regularly.
Okay, so how many articles you are reviewed?
So I have reviewed 3 articles.
Okay. Thank you.
Thank you, sir.
Okay, sir. If you know any other questions from the jury side, so can we move on to the next presenter? Okay, thank you, Kajal, for your presentation. So okay, I'll call upon the next presenter. 2021-00-00-041. Milind.
Sir, sorry to interrupt you. How many more posters are there, sir?
Just 2 more, sir.
Okay, sir.
2 more. Okay.
Including this one.
Okay. Including this one too. So are you there, Milind? 401-2021.
Yes, sir. He has joined in video.
Okay. Hello, Milind, are you there? The registration number is 14.
Is my voice is clear?
Okay, yeah, got it. Yeah, clear, sir.
Sir, my voice is clear?
Yeah, clear, audible. We are hearing.
Yes, your voice is clear. Are you hearing us? Milind sir, are you able to hear us? Are we audible to you?
Not so much clear, ma'am. Your voice.
Ma'am, sir, take off your audio cable, headphone from the device. Take it out.
Now it's clear, ma'am.
Yeah. Okay. Now you are clear too.
Yeah.
Salim sir, can we continue?
Okay. So today I'm presenting this my article on prevalence of osteoarthritis of knee joint in coal mine workers. Introduction to this topic is like CIL, that is a Coal India Limited, have 352 mines, of which 150 are underground mines. So that makes this study very crucial thing. And underground coal miners, victim of a repetitive movement, and repetitive movement which have an ability to alter the structure, and we can cause early degenerative changes. So osteoarthritis is most common joint disease and is expected to become the 4th leading cause of disability in a worldwide in upcoming years 2021. So the need of my study was the Industrial Injuries Advisory Council is working on the evidence to confirm the disease and occupational exposure, which can double the risk of injury. As we have seen, the underground coal mine workers. Presently, there is an era of open mines, not the underground mines, but there are the underground mines which are now also working and going deep into the core of the earth. And the worker working over there, we can't imagine the environment over there, because really it's what I was searched was really problematic, and the positions and the postures while working in that coal mines is really problematic. So worker will get is like if I get a problem findings and the way the posture what they held during working in the coal mines, the worker will get a disability benefit occurring due to the early degenerative changes in the knee joints for availing the benefits in Disability Act. At the work site, by performing certain tests and the self-reported symptoms by the miner and the prevalence can be noted. In view of this, the need was felt to carry out the study. So this was the observational study with a convenient sampling size of 300 coal miners in the underground coal mines. So I have used 3 tests. That's a Q angle, Clark test, and lateral step test. As we know that exact test we are not having to find out the osteoarthritis. We can go with both the adjoining things with our physical test and the X-ray criteria according to the Lawrence criteria. So matching with these 2 criteria, we can find it out there is a degenerative changes. But as a physiotherapist, we don't have any specific test to find it out that is a osteoarthritis of knee joint or not. So the prevalence what I found in this study was 39.9%, and really that was a greater in this things. And when we got into a discussion, so the posture, like a kneeling posture, standing, and the loading, what they carry on their head for certain duration, that cause a lot of difference in their postures, and which lead to a degenerative process, early degenerative process in them. Thank you.
Yes. So over to the judges. Your presentation is over. I mean, Mr. Millie.
Yes, sir. Yes, sir. Yes, sir.
Okay. Okay. Thank you. Over to the judges.
Sir, I would like to know from you
yes, sir.
whether your intention was to only find the prevalence or also look into the causes.
Sir, prevalence plus cause factors.
So you told only about posture, but there could be n number of causes which could result in osteoarthritis of knee.
Yes, sir. There can be a different causes other than the posture, but the thing was the environment over there, the steps over there, the other things like what kind of load they are carrying. So regularly they have to carry it for a 50 to 80 kg weight on their head. So that load carrying for a longer duration, and the specifically kneeling posture and a standing thing, the height. So that make more prevalent to go for their osteoarthritis, degenerative changes.
Correct, sir. But did you went into those details? I am asking.
Yes, sir. Yes, sir. I means like there are the confounding factors in these things. Other factors also which can make an error or which can have a bias in this thing.
Yeah, like maybe their diet and their previous health conditions. All
Yes,
those
sir.
things
Yes, sir.
could be contributing. So I just wanted to ask you, did you look into those factors also?
No, sir. In this study, I didn't look into their diet, what kind of diet they have gone, or what kind of other activities they are going with, which can lead them into osteoarthritis also.
Okay, thank you.
So
in your inclusion criteria, this population is mentioned, right?
Yes, ma'am. Yes, ma'am.
So you are going to exclude any other criteria which is specific with this, because you have mentioned in your title that underground
Coal mine workers. Yes, ma'am. Specifically underground coal mine workers. Because in Nagpur, where I stay, so there are the 4 underground coal mines, and which I have done was 290 feet production is going on in 290 feet.
Okay.
So it is one of the deepest underground coal mine.
Okay, good study.
Thank you, ma'am.
Any questions from the judges side?
No, sir.
Okay. So can we go to the next presenter? Thank you, Mr. Malin, for your presentation.
Thank you, sir. Thank you for giving this platform to me and for your cooperation also, sir.
Yeah, it's a pleasure. Okay. So move on to the next presenter. The registration number 2021 000015.
This one is the last one?
Yeah, last one. This is the last one.
Yes, sir. Yes, sir.
Very good, Harshita.
Good afternoon. Sir, can I start?
Yes.
Good afternoon, everyone. I'm here to present a poster on the topic Improve Balance Confidence in Older Adults, and my registration number is 2021000015. So
Hello.
here the introduction. Hello.
Continue. Carry on, carry on.
Okay. So here the introduction means low balance confidence or false self-efficacy is a major health problem which can lead to avoidance of activities causing restriction of physical activity and participation in daily life. This results in physical frailty and loss of independence. And the objectives are prevent fall of injury, prevent the fall or injury, improve posture, improve strength, improve standing balance and locomotive performance in older adults. Methodology as per the PRIMSA, that means preferred reporting item for systematic and meta-analysis studies state that there are several scales which capture individual activity to perform activity of daily living without falling, like FES means false self-efficacy scale, ABC activity specific balance confidence and Berg balance scale. Here the conclusion of this study are reduced balance confidence in older adults, use intervention designed to improve balance or prevent fall. Here the example I have taken for the exercise, like standing weight on one leg, raise on the other leg on the other side, and walking while alternating knee lift with each step, using equipment like BOSU, that is the balance board, which is an inflammatory dome on top of a circular platform which challenges the balance, and the perturbation-based balance training. In it, intervention involving repeated postural intervention aiming to improve control of rapid balance reactions. Thank you.
Sir, over to the judges.
So no question from my side, sir.
Okay. So any questions from other juries?
Which tool you are going to use, dear?
Ma'am, can you repeat the question?
Which tool you are going to use, as you have mentioned in title that improved balance confidence in older adults. So here for older adults.
Yes, ma'am. Older adults, generalized population, geriatric population.
Okay, so it will be vast, I guess, population, right?
Ma'am, I have used the tools like
yes,
BBS scale, Berg balance scale, ABC scale, activity specific balance confidence, and FES, fall efficacy scale.
But it is very vast population. That on what basis you are going to include that older adults? See, according to some specific guideline or some specific criteria that you need to mention over here.
Yes, ma'am, I have mentioned according to PRIMSA statement.
Because it,
PRIMSA, ma'am, PRIMSA means preferred reporting item for systematic and meta-analysis.
Okay. And what are your interpretation?
Ma'am, I have इसमें हम assess the effectiveness of different interventions, like all these scales determine the effectiveness of the person, like how much balance is altered of that person. And
so your criteria, see, my question is, your criteria is also getting varied, na? See, say for example, I am having one person who is having 65 age group. Chalo, let it keep 65 age group. Okay. Now the person is having 65, old person, it is considered as age group. Okay. And you are using the 4 to 5 scale. Now, according to scale, how you are going to rule out for each, for that particular person, that how it will getting affect, or the effect of particular scale. समझ रहा है बेटा? मैं ऐसा बोल रही हूँ आपको कि एक ही पर्सन आपने लिया 65 एज ग्रुप वाला, चलो उसके ऊपर आपने 3-4 असेसमेंट टूल यूज किए बैलेंस के. अभी हाउ यू आर गोइंग टू रूल आउट that which is beneficial, because in some it is clearly mentioned that only basic care as well as ADL activity is mentioned. So there every activity will be in static position. In some components only dynamic activity will be fulfilled. So on what basis you are going to rule out for each subject?
Ma'am, I have studied a study and it is mentioned that the FES is going to rule out, like if a person is actively performing and we can use the FES, and if there is something balance is lacking, so we can perform ABC, that means activity specific balance confidence.
When you are using fear of fall na, the
Yes,
person is
ma'am.
having problem with dynamic, right?
Yes, ma'am.
So you will more focus on your static only.
Yes, ma'am. Yes, ma'am.
Okay.
Okay. Any other queries from the jury side? Otherwise, you know,
One question from my side, Harshita.
Yes, sir.
What is your outcome measures in these all 4 article or 5 article you reviewed?
Sir, I have read all these interventions. I have found that all these cases useful in that persons. Like outcome means the geriatric population risk of falling. It improves the standing balance also and locomotive function and self-efficacy in balance control. Basically, I am focusing on balance control.
So you are taking some questionnaire scales, or you are
Yes, sir, all these scales are questionnaire scales like ABC.
all the scale are questionnaire scale.
Yes, sir. Yes, sir.
Or
All these
there are no type
questions.
of any intervention.
No, sir.
Means you go to the patient and you fill up the questionnaire and you go to go with the results.
Then I will found out the outcome. Then only we can perform the activity. That how much level is
After the scale you give the intervention, na?
Yes, sir. After the scale, that how many grades are affected? Like 0 to 4 means 0 means ki matlab 0 means no and full, and 5 means the full activity. That if person is having 0 grade, then
So
means
how many scale you have to taken?
So 3 scales I have read.
To each and every person.
No, sir. According to the activity level.
According to the activity. Who decide the according to activity level?
Sir, as the patient comes to us, so I can define according to the walking pattern and how can perform the scales.
Means each and every person who have to elderly in age after the
Yes,
above the 60 use the who include your inclusion criteria.
Yes, sir.
But any type of balance, confidence, or any type of disbalance, integrity is not there.
Yes, sir. Yes, sir.
Means any type of disbalance is there. Yeah.
Sir, I like FES and ABC. If the patient is having balance confidence lacking, then I can perform ABC scale.
Okay.
But if the patient is not able to perform activity of daily living, then I can perform ABC. That
scale.
means activity specific balance confidence. I can perform it.
Okay. Thank you.
Thank you, sir.
Okay. So I think no more questions from the jury side. Any questions from jury side, judges, sir? Okay. So this was the end of this session. So for the 11 presenters have presented already the e-poster. So I would like to thank again the juries, Dr. Yogendra and Dr.
Pushpendra Yadvanshi.
Sorry. Dr. Pushpendra and Dr. Vinod Kumar sir and Dr.
Nancy Modi.
Nancy Modi. Yeah. Okay. So if anything else, otherwise we'll end up the session. Over to Chandramohan sir. Maybe.
Yes, sir. I request our juries to join with us for our post-lunch session of GERICON Day 1. Immediately, we will be providing the link. All are welcome. Thank you, Stalin sir. And
I would like to add a little. Dear and respected judges, kindly fulfill that evaluation sheet and kindly forward it to me so that I will be able to, work on that.
To the same mail ID. You can reply to through the same mail ID
Yes.
if you have received the evaluation sheet.
Sure, ma'am. Sure, ma'am. Sure. I'll do that.
Yeah,
Thank
you.
you, sir.
End the
Thank you
meeting,
so much,
madam?
sir. Thank you so much, ma'am.
Yes,
Thank
yes,
you so
madam.
much, Nancy ma'am. Sir, you are the host. Kindly end the meeting, Chandramohan sir.
No, I am not the host, madam.
Oh, you changed it.
Yes.
But it's showing me leave.
Yeah, thanks again,
Yes.
Dr. Pushpendra sir, Nancy madam,
Yes,
and
sir.
Mohan.
Respected jury members,
Yes.
Bye all.
Okay.
Okay, sir.
Bye, sir. Thank you.
Okay, bye. We'll end up the session, sir. Chandramohan sir. Okay. We'll catch you after the